All right, so now after the chiropractic part of it, we're going to incorporate that with some physical therapy. And in his situation, I want to work on more eccentric loading of that tendon. To start with, we'll slowly get from eccentric into concentric, meaning eccentric will be the negative. I want to lengthen that tendon as we go with an applied load or force on the ankle. And then concentric would be more the positive, like kicking the leg straight. So what he has trouble with is the jumping. Last week, it's been a week. He started with just some very basic loading of that tendon and sitting. I'll show you that in a second. I want to get a baseline though here first again of the squat. He had pain with squatting last time, pain with jumping. He played over the weekend up in Minnesota and it was much better? Yeah. Okay. So it's already we're making changes to get this tendon reloaded because he's young and healthy, so it's going to change. All right, so squat real deep, show him what we got. So before that would hurt when we did that. How much pain there now?
Not very much. It's really not.
2, 3, what number was it? 2. Okay, last week we were probably, I think 5 or 6. We did it last week on Monday. Is that what you said?
Yeah, like 5.
Okay, like 5, okay. All right, so up here. So here's what we're going to do. We're going to show you the movement that we tried last time. So he's got long legs, so I raise the table up real high. Now there was weakness in this tendon when he was performing these movements. When I had a band back there with his ankle weight, he had a real trouble getting it up there and then lowering down, almost like it was shaking, and he had to help the other leg. And that's just from the tendon. The muscle's not weak, it's just the tendon was not properly healed. So we're going to start with some weight here. All right, I'll kick that all the way straight. Not too bad. Okay, down slow. See a little bit of shaking there. So on the way up, that's the concentric or the positive phase. So come all the way up. Okay, on the way down slow, that's the next. Here's the eccentric. It's lengthening as we come down. Okay, I want to work more eccentric, so we're going to add more weight. And then we're going to have his other leg or my hand help him on the way up. I don't care about the way up right now. Oh shoot, we'll put on your foot. It's not going to fit. Okay, so use your other foot, and we're going to help it up to add. So we're going to use the right leg as the assist. He's going to hold real tight, and then down slow. Down slow, down slow, down slow, and then relax. So what I want here is I want him to reproduce the pain, the symptom that he feels right there. In anywhere between 4 and 6 out of 10 to make that tendon remodel in the body to lay down new scar tissue to new collagen. This is one way to do it, is eccentrically you're loading that tendon in a negative way. So go ahead and come up again. He's going to help it up. So he's using that leg to start it with, and then transfer the weight over here, hold, down slow, work it. Rest. How much pain on that one way down? Between 4 and 6 or not?
Probably like 4.
Okay, keep going. So we're going to do 10 this way, and then I'm going to just, as this heals, eventually he won't have much pain as he does this. It'll be a 2 or 3. Then you got to add more weight. You got to put another 5 or 7 pounds on there to get it back up to that 5 to 7, or 4, between 4 and 6 out of 10. So you're consistently over time adding more and more weight and remodeling that tendon so it heals. And then he'll be able to do, like he was already feeling better with jumping over the weekend. Give it 4 more weeks of healing, and you should have no trouble jumping, changing direction. So, all right, we're gonna work on this. We'll pause that, and then maybe if there's one other thing, we'll show it to you. Thanks. Okay, one thing I forgot to add. In tendon problems, typically there's what's called a painful arc. Whether it's a shoulder or in this case it's the knee, when he's down here, there's no pain down here, right, really? And then go ahead on the way up through it. And there's really probably not much pain up here at this end range. Now it'll go down, it'll be no, there it is, it's kind of falling, keep going. And then once he gets past it, then it's gone again. Same thing happens in his squat. When he's squatting, he's like, not there, there's pain, and then once he gets low enough, then the pain goes away again. So it's just in a very specific arc of movement, and you'll see it a lot with the shoulder too, where it'll be no, yeah, there it hurts, and then you pass it, and then it's gone again. So just think of it that way too if you ever have that pain.